Today, we want to highlight and honor the career of a true icon in our house of surgery, Dr. John Lehman Tarpley, but better known to virtually everyone as Tarp. Hello, my name's Mike Sarr. I was one of Tarp's first interns in 1976 when he was a chief resident at the Johns Hopkins Hospital.
And I am Fiemu Nwariaku. I was one of Tarp's medical students in the 80s in Nigeria. Tarp, your colleagues offered many descriptions when asked to describe you: an inspirational, international, surgical humanitarian, globalist, a true educator, devout believer, and they use the word service. So I'll ask you, how would you describe yourself today?
I tell people I'm hyperkinetic, nonlinear, I'm a Luddite, I'm a bleeding heart liberal. There's a verse in Psalms that says the getting's in the giving, and I maintain you can't outgive God.
From now on, we're going to put some well-known Tarpisms at the bottom of the video that he often quotes. Trust me, you will enjoy them. So Tarp, tell us, what has been your mission in life?
Well, the word mission in Latin was mitto materi misi misum. My faith-based background is from Christianity. And so my goal is to try to increase and improve healthcare. The term we use nowadays is capacity building. One person can't do it, but if you can go and train others, then they train others.
Where did you grow up, and how did that environment and your family life mold your future plans?
My dad was a Baptist pastor, so I got a lot of this obviously from him. We lived in Mississippi. My dad was on the board of trust at Mississippi College, and it came up the possibility of taking federal funds to improve the college and access for students and things like that. And he supported accepting federal funds. The opposition said, no, if we accept federal funds, they'll start telling us that we have to integrate Mississippi College, and we're never going to do that. They did not want an integrationist. So anyway, he took major stands.
So tell us about several of your true mentors.
So in high school, I kind of imprinted, and kind of my role model was the chemistry teacher who was the basketball coach. I love basketball. I tell people I may be short, but I sure am slow. But I really love basketball, and I couldn't play at our level, so I was manager and trainer. I was 4 years manager and trainer for basketball, going through Vanderbilt. So I tell people I went to Vanderbilt on a basketball scholarship, and they look at me kind of funny. At Hopkins, though, my main guy was a guy named Dick Kiefer, who was at the Lock Raven VA. He could do anything. And then the other one was our chair, Dr. George Zeidema. But Zeidema really made my academic career such as it is.
Was there a moment during your training when you realized what your mission in life really was to be?
My senior year in medical school, we could get the New England Journal for like 25 cents. And there was a letter to the editor. And this physician in northern Nigeria wrote a letter. How about some of you bleeding heart liberals and going to your country club buffets on Sunday, getting off your butts and coming over here and helping some of these sick folks? The other relates to what I call mathematics and God. The number of surgeons we had in Baltimore versus the surgical workforce in sub-Saharan Africa, they're just logs apart.
So how did you end up going to Nigeria? And
we went to talk to the people at the Southern Baptist Convention Foreign Mission Board in Richmond, Virginia, the man who's in charge of West Africa. So I said, do they have any interns or any residents or doing any education? I said, I don't want to go and just perform operations. I want to go and train the workforce. And he said, let's talk about Ogbomoso. They had 5 people in training. So that worked really well for me. Hospital had been there since 1907.
Tarp, what was the most difficult part of that transition to Ogbomoso?
Well, quite frankly, it was seeing people succumb to complications from operations that would not have happened in Baltimore. Well, there was no nutritional support. There was no TPN. We didn't have stoma bags. Didn't have anesthesia. I was in charge of anesthesia. I took anesthesia call every third night. We didn't have IV fluids. We often didn't have water or electricity. So I went home and told Maggie, she said, you're not in Baltimore. That's why you're here.
Tarp, I understand that the mission required you to spend 3 years or 4 years at a time, and then to return to the U.S. for at least a year. Why was that, and what did you do those years?
One of the reasons we wanted to go with the Baptist is that we didn't have to raise our own funding. I was supposed to stay at Hopkins, but Zidem and I became very close over that. So I went in to tell him that Maggie and I had been thinking about it, praying about it, didn't have peace about staying in Baltimore. So I walked into his office with fear and trepidation. I gave him my spiel. I said I didn't know if it'd be 3 years or 30 years. And then he said, well, if I'm going to be out-recruited, I'd rather be out-recruited by God than anybody. It's time for your stateside assignment. I will have a job for you for a year at the Loch Raven VA. And he made that happen. And I got to meet like 15 years of residents that I would go to teaching conferences with. And most people didn't like the VA. I thought the VA was nirvana. They had photocopy machines, and I had a faculty appointment at University College Hospital, University of Ibadan. We would do hours of CME credit so that the missionary surgeons could get their CME credits every 2 years so they could keep their state licenses. So I started going to that in Kenya. So I've been going there every year, off every other year, and now every year since 1980 to put on these faculty development courses to get CME working like that.
Tarp, while in Nigeria, you developed a long-term relationship with the now late Dr. Don Meyer. And how would you describe that relationship?
We met in an elevator in a hotel in Atlanta. Well, it turns out that Don's wife, Patsy, and Maggie, my wife, they both went to the same high school. They knew each other, and they were friends. He wrote me a letter, and he said, Tarp, the job I want is your job. He said, I am so tired of going to faculty parties, and all anybody talks about is how to keep the algae out of the swimming pool. And so I said, well, we need you here. And so Meyer came out and visited and came to Nigeria, and he was a godsend. And he said, we need to do a research project every year and present it at the West Africa College of Surgeons, and then write it up and include our residents, our trainees in it. And so that's what we did.
My name is Patsy Meyer. My husband was Don Meyer. Don often described their relationship as John was the sail and Don was the rudder. Meeting John Tarpley had wonderful, innovative, creative ideas, and Don Meyer was the feet on the ground rudder who implemented with John the things that they came up with to make an outstanding surgical practice in Ogbomoso for those few years together. They brought academics to a little town called Ogbomoso, Nigeria. I am very happy for you, and I'm sure Don Meyer is smiling down from heaven.
Don had helped us form and become part of a basically family medicine training program, which included surgery and OBGYN in addition to pediatrics and medicine and community health. And so they would take 2 or 3 years for the part 1 and then 3 years for the part 2. And many of them would like to do surgery.
Let's talk about the most important person in your life is your wife and your working colleague, Maggie.
I tell people that Maggie's the brains of this operation, and I'm kind of the pip out front trying to draw a crowd. Well, first off, I think she's God's gift to John Tarpley and to our kids. We're known as Team Tarpley around here, and she's got an adjunct position with the University of Botswana in the Faculty of Medicine, got a position at Vanderbilt in the Department of Surgery as a surgical educator, and she's done that for like 20 years. She puts out a newsletter every morning, summarizes the articles 5 days a week that apply to global surgery, women's health issues, and things that everybody ought to know.
John and I do work very closely, and we've really been a team in medical education really since about 2000. But one of the things that I also tremendously admire in John is his confidentiality. But John never betrays a confidence.
Tarp, your visibility in the U.S. From then on has really been in surgical education. I'm curious about your philosophy as a program director, both here and overseas. And some have asked whether a program director should be act as a friend or as a father figure.
I think that the ultimate goal is for the trainee to succeed. I think at times they may need a pat on the back, and at other times they may need a kick in the butt. You know, I had a sign over my wall, that that basically we wanted them to succeed. The sign said high expectations. we have high expectations of you. And what I want you to do is to be the go-to surgeon in your hospital, where all the physicians want their spouses to go to you and all the nurses want to go to you.
Once you said that you were the highest paid surgeon you knew. What do you mean by that?
When I would come back every fourth year, I would sometimes be invited to give talks at the Baltimore Academy of Surgery. And there were like 50 white, older, wealthy surgeons in the room. Then there was me. I said, I realize I'm the best paid surgeon in this room. I just get paid in different currency. And then I would say it's my residents and my students and my patients, and that's non-taxable income. It's not all about the money. And I try to tell them that money is like drinking salt water. The more you drink, the thirstier you get.
Talk about your work in global surgical training these last 32 years. One of your close friends, who you mentioned before, said that he thought you lived by the following adage. And the adage is, give a man a fish and he will feed his family, but teach the man to fish and he will feed the community. What do you think about this adage?
One of our medical students who did a burn fellowship with us, who's on our faculty here now, who I consider one of my daughters, she spends a month a year as a plastic surgeon in sub-Saharan Africa. And he said, they know how to fish. These guys are educated. They're smart. They don't have infrastructure. They don't have supplies. She said, what they need is a fishing pole. They know how to fish. I've tried to go to the WACS meeting every year that I was in Africa when I was in Nigeria. And once I got back to Nashville, I would try to go to the WACS meeting as one of my weeks of vacation. I tried to go back to Nigeria for 2 or 3 weeks every summer or every year. And so I went to the WACS meeting in Calabar in 2010. Basically, the session was, what are your needs? Their needs were gloves, suture, instruments. One of the biggest needs are basically a capability to do skin grafts.
Tell us about the Vanderbilt Institute for Global Health. What's your role there?
And so now we actually have research collaborations between Vanderbilt and the Kajabi Hospital, which we've had 2 or 3 of our people from Kajabi that have come here to be and get instructions and learn how to apply for grants and how to do the grant processing and everything. So Rhonda Marie Kaufman has really taken it to the next level. And so it is basically now surgery is a part of VIGH.
So I know that the Pan-African Association of Christian Surgeons, which is called PAACS, is very important to you.
The Pan-African Academy of Christian Surgeons is what it is. And it started in the idea was in 1995, and it really started in 1996. But so they actually asked Meyer and I to come and talk to them as they were launching this. And we said, we think this is laudable. They had 1 trainee. We need to collaborate and cooperate, not compete. And in January, we'll have 195, and we're in 26 programs in 12 countries. And it used to be just general surgery, then ortho, then pediatric surgery, and that's our best success story. But now we've got a neurosurgery program. We've got a cardiothoracic program. We've got a head and neck fellowship. We've got OBGYN program. And really importantly, we've got an anesthesia training program. It's basically an ACGME type training program with graded autonomy under supervision. We spent a year in Kigali, Rwanda at the University Teaching Hospital there.
Now, tell us about being the chief of surgery at the University of Botswana. How in the world did that ever come about?
Botswana started a medical school in 2009. They had an internal medicine residency program. They didn't have anesthesia, OBGYN, or surgery. They're saying, can we start a general surgery residency program? And Maggie said, well, we ought to at least look at it. I had an incredible hour meeting with the dean of the Faculty of Medicine. She said, we want you to see if we can and should start a residency program in general surgery. We want to start one in anesthesia, and we want surgical education to look like something that was made for us. But Bill Wood asked me at the ASA meeting, would I take over academic dean role for him? He did, but it's a gazillion Zoom meetings, and I go to Sub-Saharan Africa 8 times a year. But basically, right now, what I'm doing now is capacity building. And so the goal is to equip folks to do the bellwether type cases. So the PAACS program, we will give you 5 years of training, 6 years of training, and you'll get a stipend, you'll get a house, you'll get books, we'll send you to meetings, we'll pay for the visas and things like that. in the travel, you're kind of bonded to practice in a rural location, in a district hospital, government district hospital work, a faith-based institution, or an educational institution. 99% of our folks are practicing in sub-Saharan Africa, and they're in a needy area. So that's what I do right now. I'm actually like the program director for the program directors and the associate program directors. We do site visits every 5 years.
Tarp, you're almost 80 now, right? What's the future hold for you and Maggie?
Well, only God knows, quite frankly. I tell folks I want to die climbing. I don't want to rust out. I do a lot of advising, and I make suggestions. We've like doubled or tripled the number of women in our program. So we work actually very closely with WISA, which is Women in Surgery Africa, which the Association of Women Surgeons works with, and which Germa Tefera and Operation Giving Back, which is now HOPE.
Tarp, if you had to pick one thing in your life, what would you be the most proud of?
So I think being able to fulfill what I think is basically my mission, which is to encourage other people. I often ask myself, what do I want on my tombstone? I think it would be, he wanted to be a Barnabas, which means an encourager.
Do you have any regrets?
Everybody has some regrets, okay? One of the things is that would be the raising of the kids and everything. Maggie did almost all of that. There's no way I can pay Maggie back.
All right, Tarp, devotion, obligation, service, these are principles that you and Maggie have and continue to live by. Do we as surgeons have such obligations to give back based on our profession and on our extensive education and training?
We as physicians have a fiduciary responsibility. We're given a lot of rights in exchange for self-regulating and different things like that. I basically see it as a calling. Some of the most important things I have learned in my whole life, I learned in Nigeria from Nigerians. So when I got to Nigeria, I operated or was in the theater 25 nights out of 30. I did like 30 years worth of operative work in the 12 years that I was on the ground there, and it didn't kill me. My granddaddy said, nobody ever drowned in sweat. Social skills that they taught me were really important. Treat people the way you want to be treated. Know people's names, know something about them, and that's an equity investment.
What advice would you give to a young surgical trainee today?
You want somebody that knows who's sick, who's not sick, when to call, when not to call, but your job is to learn all you can.
Everybody in the audience, I think you've seen why we talked about Tarp as an icon in surgery with his inspirational teachings, and we've all learned a lot. Thanks very much to both you and Maggie. The world's better because of you.
Thank you, Tarp.
Thanks a lot. I appreciate this opportunity. Thank you.